Hello and welcome.
Thank you for having me.
Please tell us your background and areas of expertise.
Sure, I'd be happy to. My name is Dr. Mark Opler. I'm the Chief Research Officer at WCG Metavante Prophase. I'm here today at ECNP because I'm part of a very exciting session on really on mood disorders, on MDD. And one of the things that I'm going to be talking about today is how we move to, frankly, more of a patient-centric view of the illness and to helping to get at the issues that patients actually care about and focus on what matters most to them.
What are some of the challenges that psychiatrists face when treating patients with major depression and other mood disorders?
It's a great question. 2019 is a very exciting year. We've seen all kinds of new advances in the pharmacotherapy of depression and mood disorders. Yet we still practice generally the same approach towards evaluation of patients and determination of what treatment to assign them as we did in decades past. This is a continuing challenge. How do we take a more systematic approach that focuses more on the patient and his or her specific needs?
Can you share some of the recommended strategies and tools that can be used to overcome these challenges and take a more patient-centered approach?
Absolutely. So one of the approaches that I feel holds great promise is something called measure-based care. In psychiatry, we've always been hampered by a lack of hard endpoints, concrete phenomenon that we can evaluate over time to determine whether a patient is getting better, getting worse, or staying more or less the same. Measure-based care is the art and the science of using assessment tools, questionnaires, interviews, and other instruments to quantify how much better or worse someone is over time, and to learn more about their condition and make better treatment decisions.
Would you elaborate on the importance of adopting a patient-centered approach?
One of the tools that I'm very excited about, technique really, called Goal Attainment Scaling. Goal Attainment Scaling allows the clinician and the patient to work together to achieve consensus on a treatment objective, and then to build a 5-point scale around this objective that allows the patient and the clinician together to track progress towards a treatment goal. Rather than evaluating one idea, one concept, let's say anxiety, instead the patient and the clinician may define, let's say, going to the gym as the patient's single treatment objective. That's what they want to do. They want to get back to maintaining their health, going to the gym, working out. Together, through consensus, this allows us to give the patient more voice and to measure and quantify their progress over time on a new treatment.
So would you actually neglect the anxiety in this case?
Absolutely not. We still need to pay attention to things that we know have clinical importance. But it's just as important to focus on what matters most to the patient and make sure that that's included in the conversation and the journey as treatment progresses.
Thank you for sharing your insights on personalized approaches.
My pleasure. Thank you for having me today.